order the Joint Appropriations 1 and 2 committees. Clerk, please take the roll.
Senator Rose. Senator Duffy. Senator Bivens. Senator Barrickman. Senator Murphy. Senator Van Pelt. Senator Trotter. Senator Stottleman. Senator Menard. Senator Hunter. Senator Hastings. Senator Delgado. Senator Biss. Senator Katowski. Madam Chair.
Did you do both committees? Yeah, you did both. He's just also. Okay. First, we have requests for photos and videos from Bluestream, WUIS, and State Journal Register. Do we have leave? We do. So we will go ahead and allow for that. And we have to please add Senator Murphy to the roll. Welcome. Nice to see you. Okay, so the purpose of... Oh, yeah, we need to read the roll for Appropriations 2 as well.
Senator Oberweis, Senator Murphy, Senator Altoff, Senator Rose, Senator Staines, Senator McGuire, Senator Menard, Senator Landek, Senator Hutchinson, Senator Hastings, Senator Cunningham, Senator Cullerton, Senator Bertino Tarrant, thank you, Senator Bennett, Senator Trotter, Chair. Katowski.
For the second time, yes, here.
We like to see him in double. We can't get too much of him. Yeah, I should speak for myself, right? All right, so the purpose of today's hearing is, last Friday, April 3rd, a week ago, Good Friday, the governor gave notice that $26 million of grants through the Department of Human Services and Public Health were being suspended. So the purpose today is to understand more about sort of the authority and the rationale for these grant suspensions. I think we want to hear testimony first from the Director of Human Services. I think he's here, Greg Bassi. You were welcome. I guess it's Acting Director, is that correct? Acting Secretary, excuse me. Thank you. Appreciate that. Now, why don't I first let you if you have any comments you want to make, and then we'll open it up for questions.
Good quarter. Good quarter. What?
So I have a brief opening statement, and then I'll be happy to answer your questions. Good morning. Thank you, Chair Staines, and all of the members who are here today. I'm Greg Bassi, Acting Secretary of the Illinois Department of Human Services. Our agency serves its customers to help them achieve maximum self-sufficiency, independence, and health. We work with families, other state agencies, the federal government, healthcare providers, community organizations, schools, and others to provide integrated services for individuals, families, and communities. Within DHS, we provide services through 5 separate divisions, including the Division of Family and Community Services, the Division of Developmental Disabilities, the Division of Mental Health, the Division of Alcoholism and Substance Abuse, and the Division of Rehabilitation Services. DHS operates 80 family community resource centers, 45 administrative offices, 45 Division of Rehabilitation offices, 22 administrative offices, 3 residential schools, 6 psychiatric hospitals, a treatment and detention facility, and 7 state-operated developmental centers. DHS has an annual budget of over $6 billion. The programs provided by DHS aim to improve the health and wellness of Illinois residents. Even in this difficult fiscal climate, and even with the grant suspensions issued on April 3rd, we continue to offer services to provide thousands of individuals with a safety net and a path to independence. I appreciate your time today, and I'm happy to answer any questions you may have regarding the grant suspensions that we issued about a week and a half ago. Thank you.
Thank you, and I want to add Senator Bennett here as well. Did he join us? I thought he did. Oh, yep, he's in the back. And Senator Berkman to the roll. Thank you. Okay, first let me just start by asking you a couple questions about how we arrived to those grant suspension letters on Good Friday. So, you sent out a letter to individuals, to different agencies that talk about this written notice is to inform an agency that the Department of Human Services is suspending community service agreement number, whatever the number is, effective immediately pursuant to and as provided by section 4.1 of the community services agreement due to insufficient appropriation of funds. Then it goes on. Take autism, for example. You know, the Autism Project, or the autism lines, did we decrease either the bills, House Bill 317 or 318 that we passed, decrease the appropriation authority for autism?
Within the bills themselves?
Correct.
I don't believe so. I mean, I think specific appropriation questions you'll probably have to ask Director Nuding. What I can testify to today is with respect to the funds that were available to us and what the decisions we had to make with respect to our specific programs for those that needed to be suspended in order to get through the rest of this year based on the cash flow that was available, based on our discussions within Gombe and our own budget, folks.
Okay, so you had an agreement. I'm going to use the Autism Project for an example on this. So you entered a service agreement, I believe, with them in July of 2014, which would expire at the end of this fiscal year. Is that an accurate
That would be accurate,
statement?
yes.
Okay, and so did you, first of all, just so I understand, is this a termination of the contract or a suspension of the contract?
It's a suspension of the grant.
Okay, so where is the authority in your contract agreement with them to suspend the grant?
I can read the specific provision for you if you would like.
That would be great.
So our general language for all of our community service agreements, including those that were suspended on April 3rd, have the language for availability of appropriation. And it states that obligations of the state will cease immediately without penalty or further payment being required if, in any fiscal year, the Illinois General Assembly or federal funding source fails to appropriate or otherwise make available sufficient funds for this agreement, or if the governor decreases DHS's funding by reserving some or all of DHS's appropriations pursuant to power delegated to the governor by the Illinois General Assembly.
Okay.
DHS shall notify provider of such funding failure.
Well, so first you talked about 2 points in there. One, failure of or insufficient appropriation authority. We did not change any of the appropriation authority in the budget. There is appropriation authority for this contract in the budget. This was not changed in anything, any actions that the General Assembly and the governor then signed these bills. So again, I don't think that there's insufficient appropriation authority as you're indicating there. We didn't change the appropriation levels.
Well, I think that Gombe has to assess how much is appropriated, how many funds are available for the rest of the year, and then make decisions about, where are we going to get that funding from and where can we actually lay that out? And I think that...
So I think you're mixing up two concepts here. There's appropriation levels, and then there's what you actually spend. Appropriation levels, I mean, that's one of the things that you're talking about here is appropriation of funds. There's insufficient appropriation of funds.
Well,
Our appropriations were set in the legislation.
Sure, but and again, this is why you're going to have to speak to Gombe. I was not part of these negotiations. I was not part of the specifics around what was appropriated and what was not. But what I can tell you is that there's a $1.6 billion budget deficit. Gombe looked at the numbers and recognized that there were insufficient funds, even with the supplemental that passed, in order to get us through this year. And so
Who signed this letter?
I signed these letters that went out.
So why do I need to ask Gombe about that?
because Gombe is where we get our cash from. And if there's insufficient cash in order to make it through the rest of the year, we have to work with Gombe in order to make those
So
decisions.
now you're going to a second point. That's different. Cash is definitely different than appropriation authority. You're here talking about appropriation of funds. That's different than actually, I think what you're referring to now is what revenue or cash you might have in hand.
Unless there wasn't enough appropriated for this year. And if
And there
there's
was
a
enough
1 point,
appropriated for this year. We appropriated sufficient funds to cover this grant.
well, I'll let Gombe speak to that specifically. My understanding is there was not enough appropriated with respect to the amount of cash that's available. And so you can look at them individually or you can look at them together. And either way, we have authority to do it, whether it's on prong 1 or prong 2.
Doesn't-
That's what we're hitting on the whole thing. She's hitting on just a very specific 3 words.
Are you focusing on the intro to this section, availability of appropriation? Is that?
You talked about that you were sending out these letters due to insufficient appropriation of funds.
That's what she's focusing on.
Oh, I'm looking at the language within Article 4.1 of each of these service agreements,
Okay?
which grants us authority whether or not there's insufficient appropriation or otherwise funds are not available, or if the governor decreases DHS's funding by reserving some or all of DHS's appropriation.
And so how were you determining that there were not funds available? Revenue. I understand. I just want to understand that that's what I think was sent in this letter is not what it was based on. But that's fine. I'm not trying to make clear that we have sufficient appropriation authority. This was being based, I think, on saying that there was not revenue sufficient. I'm just making sure you're understanding that distinction.
No, I understand, and maybe the language in the letter should have been better. I agree with that. But it doesn't change our authority with suspending these grants, whether it's under the agreement and then also working in conjunction with Gombe, who is the one that would know what resources are available and whether or not we can make it through the rest of this year on a balanced budget.
All right, so then you're suggesting that this is being done based on not having sufficient revenue. Under what basis were you making these decisions? What led you to decide that you needed to look and see where you needed to, you had insufficient revenue and you needed to make decisions to cancel some contracts? What prompted this kind of action and review and sending out of those letters that you did not have sufficient revenue to meet them?
Based on discussions with Gombe.
And what was Gombe guided by anything, or did they send you any directions to give you some guidance on how to think about this?
Well, I think a lot of these questions should be, reserved for Director Nuding, but I can tell you that since as far back as January, in a comprehensive approach to address the $1.6 billion budget deficit, each of the agencies, including DHS, has been asked to look at all of its grants carefully. I mean, we have hundreds of grants, and so since January, we've focused on our grants, and it's been a continued assessment of those that we thought, in order to fill this budget deficit, which grants could we suspend yet still remain able to provide our core services. And so that's been a continued process, and since January.
And in January, I think it might have been January 12th. I could be wrong on the date. That's my recollection. I think you might have received an executive order 15-08 that was to that the governor issued, talking about reviewing contracts. Is that what you're referring to?
Yes, that's part of it. I mean, it's part of an overall process of Gombe. It's number one, you've got your executive order, which addresses essential and non-essential. And then in addition to that, you still have, Gombe's got to assess the resources of the state and determine whether or not we can get through the rest of this year in a balanced budget. I can't speak to the specifics of that. You're going to have to ask Director Nuding.
Right, so what actions did you start taking when you got that executive order? What did you start doing to try to comply with that executive order?
Well, I wasn't at DHS when the executive order came out. It predates my arrival. But I can tell you that throughout the agency, and at the direction of our acting CFO and budget director and those throughout the budget office, started looking at our grants and our specific programs very carefully, crunching numbers to try to determine how we could get through the rest of this year in all kinds of scenarios, based on whether a supplemental came through or not, depending on what the size of that supplemental would be. It's a very complicated and involved process that took place between our budget folks and Gombe, and there was a lot of back and forth. And to say that it's a particular date and time or how, a particular program, it didn't work like that. It's an overall big picture project to try to find ways to get through this year based on a balanced budget.
In the executive order 1508, one of the points it talks about is review and termination of non-essential contracts. That every state agency shall review all contracts that require the expenditure of state funds that are not essential for the state agency's operations. Is that what you're sort of referring to?
Yes.
That you were starting to take a look at?
Yes.
And I think Senator Kotowski, I think you had some questions you wanted to ask about that. I may come back for some more as well.
Sure.
Thank you very much. I believe we have to add some people to the roll.
Did we not add Senator Menard to the roll? Sorry, if
Senator
not. I did add you, Senator Bennett.
Senator
when you were
Ryder,
back.
and
And
Senator
Senator
Resin.
Resin.
Good morning.
Morning.
So just, by way of introduction, I think the last place we wanted to be here today was to be discussing fiscal year 15 again.
I agree with that. I'd
Right.
rather not be here today.
So, thank you for your honesty. But while we're grateful that you're here. So, there are times when, in the course of being a public servant down here where you feel good about what you do, and also there's times you feel very frustrated that the ball's not moving down the field. And so a few weeks ago was one of those times we felt like a bipartisan resolution was passed to address our funding challenges, and something that talked about for years is accessing these 700 plus special interest funds that have standing balances to help provide dollars for programs without raising taxes, without borrowing money. And so I felt good about my vote, because one of the areas that we had talked about at length was it was going to provide support for childcare. As you know, that's been a huge discussion here, and support for mental health, and support in particular for autism. That was a top priority that I know we had discussed, and I know members of my caucus care greatly about, as well as some of the other programs that were stated before. So, I felt pretty good that we were moving forward. And then for all these agencies to get a letter on April 3rd, Good Friday and Passover, it was a real kick, in the gut. And it was, it can take some of the wind out of your sails when something like this happens, because you feel like you're making progress. And I know you in your position, the last thing you want to do is to send a letter out like that. And probably the last thing you want to do is to send a letter out like that on a holy day. Can you explain to me what was the reason why it was sent out on Good Friday?
Well, there's no reason why it was specifically chosen that Good Friday. It just had the unfortunate circumstance of being Good Friday when the letters had to go out. I think the supplemental passed on, I believe it was March 26th. It took Gombe some time to review, the funding authorized within the bill, and it took. And again, I don't want to speak out of turn. Some of these questions are going to be better asked for Director Nuding. But I think it took some time to analyze, what sort of resources were available, in conjunction with what's been authorized under the supplemental, and then, what are our obligations and expenditures for the remainder of the year.
Sure.
As soon as they figured that out, we discussed with Gombe, the scenario and where funds were at and what needed to be suspended. And so
you had a discussion with post the supplemental bipartisan resolution to the budget was passed. You had a discussion with Gombe to talk about the criteria for analyzing spending within your agency.
Well, I think the criteria for which specific grants
Yes.
could be suspended had been an ongoing conversation since January, as
So
I
you
mentioned.
didn't have any conversations?
No,
with-
we discussed it, but it was up until that, once they figured out what was available, and we were informed, and we wanted to get those letters out immediately, because the longer we waited,
Just
then
real
the
backtrack.
deeper that
I understand
the
the
cuts
action you
would
took,
end up being.
Just real quick, and I apologize for the interruption, just to backtrack just a brief second. So post the budget, the bipartisan budget resolution that was passed, the fiscal year 15, did you have discussions to review the grants and these line items in the Department of Human Services budget with the Governor's Office of Management budget? And did you have input as to whether or not something was essential or non-essential?
We had already provided that input at length prior to the supplemental. I was not involved in any of the discussions or negotiations over the supplemental. I can't speak to those.
Okay.
But all I can say is what the input that we provided as far back as January continued until we issued those letters. It was all consistent with the positions and the advice and the information that we had provided Gambi all along.
So when you say we have provided, you don't mean that you provided, you mean we as an agencies collectively, or do you mean that you provided?
We as an agency and our budget folks
So if-
speaking through me and at our direction.
What I'm trying to get at is when you look at some of these decisions that were made in terms of what's essential and what's non-essential, do you agree with some of those decisions that were made about the criteria of what's essential or what's non-essential?
I trust our program folks working with Gambi to make, these are near impossible decisions in some of these cases. It would be nice if we could fund all these. We're stuck in the reality of our fiscal situation.
Right.
And it was a lengthy, difficult, and thoughtful process to get at which particular grants we could suspend and still maintain our core services throughout the rest of this year. It's the same discussion that we had at our appropriation hearing looking at fiscal year 16. This was not a callous or, unthoughtful approach. This was very, a lot of people with a lot of experience and that understand these programs and can provide a lot of input on them, thought about them, and gave their input.
So-
and it's not easy. I'm not
Right.
saying that these were all very
Sure, I
difficult
can understand.
decisions.
So you indicated to me, you used a couple things that I heard you say it was not easy. But let me just take a step back and come back to that point. When you look at the budget that was passed, the appropriations bill that was passed a few weeks ago, did it include any cuts to Project Autism?
I don't believe the language in the bill had cuts to autism, no.
Why do you think that is?
I can't speak to what people said or what they negotiated. I was not part of that, so I really don't want to have to give.
You're in a.
He said he doesn't know. Why
You're in a
are you
position-
asking him something that he
Excuse
has
me,
nothing to do
You're
with?
in a position of, it's a pretty big job, $6 billion budget. Why do you think the General Assembly would want to keep Project Autism funding level? Why do you think we'd want to do that?
I'm not going to speculate about why specific line items or specific appropriations.
Do you think
were
it should have
included
been
in that
cut in the budget that was passed, in the supplemental budget that provided that appropriation authority? Do you think, in your experience as the acting secretary of DHS, that we should have cut services for people with autism, children and adults in our state?
This specific line item, do I think it should have been cut?
Yeah.
I told you I don't like having to make any of these decisions. They're difficult decisions.
I didn't
But
ask
it's-
if you. I
but
didn't ask
it's
you didn't
not-
like it. I asked, do you think it should have been? Because this is obviously a
Are you
dispassionate.
going to let him answer a question
This
without
is-
interrupting him
this
today?
is a. This obviously this is a
Are we
dispassionate.
serious here?
This is a dispassionate discussion, and you'll get your opportunity, sir. It sounds to me like it's a dispassionate review and criteria is established. Do you believe that it should have been cut in the budget? Do you believe that there should have been, given the fact that these actions were taken to suspend dollars for Project Autism, why wasn't there an effort on behalf of DHS to just cut this funding in the recent budget resolution?
Okay, couple things on that. Number one, it wasn't dispassionate. There was passion in making these decisions as far as trying to figure out how we're going to maintain our core services. Yes, I agree that the specific line item if we're making priorities and we're trying to figure out our way forward in an emergency, a fiscal emergency, which is what we're faced with, yes, I think this is one of the line items that needed to be suspended in order to get through this year. It's not the only autism services we provide. It's one provider and it's one program. I think there's a misconception out there that DHS is no longer providing services for individuals with autism, and that's not the case. I understand that it's an important program and that it's important in the lives of many individuals and families in Illinois. But we also have 3 Medicaid waiver programs provided within our Division of Developmental Disabilities that provides a whole range of services, assessments, eligibility determinations, residential support, 24-hour care for individuals with autism. I can't give you the percentages. I know that those are on the waiting list. It's approximately 26% of individuals that we service have autism spectrum disorder. But we also serve individuals with intellectual disabilities, those with cerebral palsy, and others with related conditions. And so while it's not an easy decision to make, we still provide services for those with autism, and we will continue to whatever resources we have available, which is limited in a year like this.
Right.
We will make those available and do everything we can because it's not dispassionate. We do care about, people in Illinois and making sure that we can provide whatever service is available. And so while these decisions were difficult, I think they were done in the right way and thoughtfully.
So just kind of walking back a little bit. So please define for me, in your mind, as the acting secretary of DHS, what's essential spending and what's non-essential spending?
For us, I think that's it's a difficult definition, and I prefer to look at it for us as core and non-core. What are the things that we, as an agency, throughout...
Well, there's a reason why I'm asking that question, and forgive the interruption. The communication that you've received is to ask you, right, to ask your department to look at spending as essential, right, non-essential, and something that would ensure savings, right? So I know you would like to look at it as core and non-core, but the definition that's been bandied about has been essential. And by the way, just how would you define essential? Now I'll give you the opportunity to talk about that.
I would tell you how I would define essential for DHS is core and non-core.
Okay, so what is that?
So it depends on the division. It depends on the service. You have to look at each program. For Division of Mental Health, it would be focused on those individuals in crisis, be able to provide 24-hour care for those that cannot care for themselves. If you're talking about Developmental Disability Division, it'd be a similar analysis, providing 24-hour care for those that need that assistance to get through the day. If you're talking about Division of Rehabilitation Services, it would be to continue to provide, in-home services for, those folks that need it. If you're talking about the Division of Alcoholism and Substance Abuse, it'd be those folks that are in crisis and either need intensive therapy or need some type of residential treatment. If you're talking about the Division of Family and Community Services, I think you would be focused on, providing food and shelter. It's a little different than the other divisions, but
You've provided a healthy list of examples of what you would determine to be essential spending, core spending, essential spending. So it sounds to me like the funding for Project Autism was determined to be non-essential. And I just want to get back to a point that Senator Staines, Chairman Staines had raised. What was the criteria for determining that it was a non-essential program? Because this is, in many cases, if you look at the numbers of people who have served, children and adults with autism by this program, it's a significant number of people. And if you look at the number of people who are, particularly I would say in my communities, many communities, there's an increasing number of people who've been diagnosed with autism, who are living with autism, and the challenges they have in the school system and getting access to care and making sure that they're able to get respite care. I mean, some of these families can't even get a babysitter, and the divorce rate is close to 80% for people who have children living with developmental disabilities. It's just off the charts. So, I mean, so looking at that, the criteria that you used to determine for this program that it was non-essential, I'm curious, how many people are served by the Project Autism program in the state?
I don't have a number today as to how many folks are served by the autism program. I think, some of what you got at was, I don't disagree that this program to individuals that receive it, likely consider it essential to them. This was a difficult decision. I'm not saying it's not an important program. What I'm saying is when you're faced with a fiscal crisis like this, and there are only a certain number of programs you can afford, you have to make difficult decisions. One of those was these individuals are still available, they can still get on the waiting list, and they can still, attempt to receive the state's services, throughout the state, as do other individuals.
See,
I know we're not going to be able to serve as many people as we were before.
Acting Director, I would caution you to be careful to use those words to go on a waiting list, because some of these families have been on waiting lists for years. I would caution you to do that. And respectfully, sir, because I think this is, if you talk, and I'm sure you have in your job, talk to people who have children or grown adults living with autism. This is one of the most challenging and rewarding, because obviously they love their children very much, responsibilities, right? So be very careful, because about saying going on a waiting list, because so many have been on waiting lists for years, they've absolutely given up hope. So, and the only hope that they have is the fact that we've communicated to them that we're going to, in the course of our budget negotiations, keep funding level for Project Autism. And that's, and it doesn't even address the number of people who are struggling, with this challenge throughout our state. So, it's a slight admonishment to you, because I just be careful about that phrase, because, waiting list is literally a 4-letter word. So,
Well,
I just want to, 1 second, I just want to add some members to the roll. We have Senators Oberweis, Delgado, Stadelman, Rose, and Landeck who have joined us.
So I just want to take you through, because I think it's important to note, as the Acting Secretary of DHS, you said something very important about the number of people who served this program. So when you were asked by the Governor's Office of Management Budget to determine what was non-essential spending and savings, was the autism program the first one that popped into your mind?
I don't have the answer to that question. Number one, it preceded me, and there's no particular program that pops into your head. We have a number of important programs. There are a number of people out there that are served by the state of Illinois, and all of them, think that their program is the most important. And I agree, because it's their life and it's important to them. And so that's what makes this so challenging. And you talk about, having passion and being, thoughtful about this process. That's exactly what this was. So it's not a matter of, what pops into your head as being not essential. It's, how do we prioritize this? How do we get through an emergency? It's just like any other situation where you're in an emergency and you need to make very difficult and challenging decisions. That's what this process was. It wasn't of, we don't care about that program, or we don't care about that program. It couldn't be further from the truth as to the approach that was taken. The people in this agency care very much about the work that they do and about the people they serve. And so it's just that we're faced in a very unique and difficult fiscal climate, and difficult decisions had to be made. And that's where we are. And to say that we don't care about these programs, that we think that they're unimportant, that's not an accurate description of how we would have approached this, or how we did approach this.
Well, I mean, I didn't use that phrase. I said that the determination of essential or non-essential. And I think that's something that's a phrase that's been bandied about, and I think really hasn't been explored as to what the real meaning of it is. I looked just briefly, I just spent some time Merriam-Webster's has a definition of essential as extremely important and necessary, right? And then it's included, and Senator Staines alluded to it, in the previous actions that were taken through executive orders to be able, you're supposed to make a determination on something that's essential. So it's been a determination. It's been a word used to make a determination. So I think that's very important. So I mean, and the other thing I want to get back to is like the spending authority, the appropriation authority is there for you to spend the dollars as the acting secretary of DHS on these programs. And so the reason why I asked that question is, there's criteria in place, and I think it was important to note respectfully, and I asked you how many people this program serves. Now, the autism program says on a website they serve about 15,000 people. 15,000. That's a large number of people. And and the reason I'm getting at this too is that on the Friday and the day the letter was sent out, Good Friday and Passover, we had someone who testified in Champaign yesterday who said on Monday, the Monday after that letter was out, they let go of 9 people. So they weren't even prepared. And it was services related to providing support for teenagers who are at risk. So I think it's key because we've gone through this process of trying to determine, and we're not there yet, what's making an impact in our state, right? What's making a difference? So have you done an analysis of the impact of the Project Autism through your agency? Let's get away from some of the previous line of question. Have you analyzed the impact that this program has on people, the state, the outcomes, the performance?
I don't know if specific, analysis has been done, or if there's specific, reports that comment on that. I know that this is one particular line item that our agency, this is, again, predates me, and this actually predates the current administration, that, DHS has gone in the proposed budget and either suggested it be reduced or discontinued in prior years, and it's throughout continued to be included. And I think part of that analysis would suggest that, historically, that, on the range of programs and services provided, that they felt that it was one that potentially in difficult fiscal years like this one, that if you had to suspend some grants or if you had to discontinue certain programs, it would be one that would be included. Not to say that any of these are easy decisions, but we are faced with, in a fiscal crisis with limited resources.
Right. And so looking at this, let's say the total line for Project Autism, let's say it's terminated in next year as well, it's about $4.3 million. In your opinion, is that the optimal way to save money? And here's what I mean. Will we be saving money in the short term, but spending more money in the long term?
I'm not going to speculate about, long-term effects of some of these specific reductions. What I do know is that if we're in this situation because difficult decisions that prior administrations were faced with about moving forward and how to realistically live within a balanced budget were not made. And so we're in a position of a fiscal crisis now, and these difficult decisions need to be made now to stop future harm and to preserve these core services in future years going down the road. And so
Secretary, why wouldn't you speculate about the long-term impact? I mean, this is a $6 billion budget, and you're overseeing this budget. It's an incredibly difficult job, very challenging job. And I imagine you're putting on a lot of fires, but you're constantly evaluating what's working and not working. Why wouldn't you be thinking about the long-term impact of a short-term reduction? Because ultimately, we have a multi-year budget proposal. It's supposed to look at revenue expenses over the next few years. If this is an expense that we take on that ends up tripling, quadrupling, if more people end up going into getting care that's more cost intensive, why wouldn't we be thinking about the long-term costs of it? Why wouldn't you be thinking about that? Why wouldn't you be speculating?
Well, it's.
I guess why wouldn't you use your expertise to make an estimate about what the impact is going to be?
Because you're asking for what's the specific impact going to be. These decisions were made with the thinking in mind that we could get by year to year by reducing, or in this case, suspending specific grants, and it's a similar analysis that's gone into fiscal year 16. So we've sat here, at length and explained sort of how we approach this and how we got where we are.
So when you say get by year to year, you mean get by year to year, what? What does that mean?
It means, balancing the budget this year, balancing the budget next year, balancing the budget the year after year. This is the start of a process to start working within a realistic balanced budget.
So you're saying that getting by, your definition of getting by year to year is to, not look at the long-term implications.
That's not what I'm saying.
Well, it is what you said. You said we're not going to look at the long-term implication. What we're going to do is make sure that we balance. Right?
And that we'll be able to balance, which would include looking at the long term.
So you believe
can these programs be discontinued this year, and will we be able to continue on in years to come? And so yes, there is a long term analysis.
So you
included,
believe, so
but I
you,
can't give you specifics about
so you
what
believe,
the effect is.
You believe cutting services for 15,000 people we're living with autism in our state is going to be a way to balance the budget and save taxpayers money?
Certainly this year, yes. And over the next couple of years, I don't see that as being a specific item that's going to cause the state increases. But I can't give you specifics, and I can't tell you, what the overall effect would be. What I can tell you is what we can afford this year, and we can't afford it this year.
So I would appreciate your looking at and providing this committee with an analysis of the there's a short-term impact, which is pretty glaring, but also a long-term impact. As the person who is in charge of this agency right now, I would appreciate an assessment, an evaluation about the impact, the number of people who are being served by the program, the performance of the program, the impact of the program. Because you have the tools right now.
Sure.
Well, just real quickly, you have the tools right now, if you wanted to make decisions about looking at funding based on the performance of it. If you're to tell me that these dollars are being wasted or misspent or mismanaged, there are tools out there. So I would really appreciate your providing this committee with an analysis of this program, what it's doing, lives that are impacted, long-term effects. I think it's essential. And just just to that point, what I will say is that, yeah, I agree, and we will look at it and provide you with something, but it's a big picture approach. It's not just, because if you have limited resources and you have to save here, then, and if we were to keep the autism program, then maybe it's something else that we're cutting. And so it's not just, it's a full picture. It's not just one program here or one program there. And it's not just one budget. This is a long-term analysis to make the state fiscally solvent, and so it's a very involved and complicated process to make. Can you imagine that the position we're in is we're co-equal branches of government, and we pass legislation that has legal authority that requires an appropriation to be spent on this particular program, and now the dollars have been suspended or frozen, and now I'm asking you to provide us for information as to why the program is worth the investment when we've made this determination as legislative bodies that this is something that's worth investing. Imagine the position we're in. We have the authority to legally, right? We pass laws which are signed into law by the governor. And now now I have to ask you, due to some action that was taken based on what, I don't know the definition of essential or non-essential, I don't know, it hasn't been provided, I don't know what criteria has been used, other than figuring out a way to try and make something balanced, which is going to cost taxpayers, in my humble opinion, an extraordinary amount of money in the future, and it's going to devastate people in the short and long term. So I'm trying to figure out why me, in this Appropriations Committee that I have to ask you for information as to why this program is worth the investment. Because I've already determined through my vote that it's worth the investment. I've already determined that with my vote. I've said this is worth the investment. And for some reason, in respect for you, and I know a lot of these decisions were made, prior to your being there, and now you're the head, you're the head of the agency, so I'm directing this at you. So my frustration is I have people in my community who are utterly devastated. They're torn apart. They don't know what they're going to do, right? They don't know what they're going to do. I put my vote out there, and I expected that we were going to follow through and provide funding and support for this. So now I have to ask you, why is this program worth something when I know that it's worth the investment? It's an absolute kick in the stomach on behalf of the people that I represent. And I appreciate you taking the time to answer the questions. I know your job is difficult. I know it's challenging. But, sir, respectfully, when you come back to this committee, I want you to know everything that's involved in this program. I want you to know the number of people served. I want you to know the difference that it's making. I want to know the number of people who are impacted. And I want to know what steps are being taken to help the people who aren't going to get the services as a result of the cuts being suspended. Okay? Thank you.
I'd like to add Senator Bertino Tarrant to the roll. We have a number of people who have indicated they'd like to ask questions. I'll run through them: Hastings, Bennett, Rose, Murphy, and Hunter. And then we will also ask Director Nuding, because I think people have some questions for him as well. And other people may have questions as well. Those are the ones I've noted thus far. Senator Hastings.
Director Bassi, how are you today?
Good, how are you?
Great. I enjoyed our last meeting that we had, and I still stand by my statements of encouraging you and your staff to come to the south suburbs to see the effects of the closure at Tinley Park Mental Health Facility on our community and the effects that it's had in our hospitals. I just want to start by saying that, militarily speaking, when you step in front of a platoon, you know that you're in charge of their lives, and you know that you have to take them to war and do some things they may not want to do. And unfortunately, I feel as if you're in those shoes of a new platoon leader right now. And I still wish you well, and I appreciate your office's correspondence with mine. But I do have some issues because I voted in favor of House Bills 317 and 318. And when I voted on that bill, those bills, I should say, it included funding to get certain organizations in my community through to the end of the fiscal year. Some of those, obviously, Senator Kotowski had spoke of, the Autism Project, but other ones to include our addiction prevention and treatment programs. And you had talked about core versus non-core services. And I want to ask you, do you consider those addiction treatment and prevention programs, are those core services?
Are you, which services are you?
The addiction prevention from the,
Right,
I can go through them all, but
the
I'm sure you
addiction,
have them too.
we had addiction prevention is what's been suspended going forward, and then there was the
Is that I just want to know, Director,
addiction
Is that
prevention.
is that essential or not essential?
It's non-core. We had to focus on treating those, with addiction, knowing that, while there's not as much service available for addiction prevention, people are going to have to rely more on the sort of education you get at schools and in communities on addiction prevention, whereas we needed to preserve the treatment of actual, those that are in crisis and facing, the day-to-day of not being able to make it through the day based on their addiction. So it's a difficult distinction to make, but it's one that we had to make.
So the answer I'm getting is no. So what about health care for the poor? Is that essential?
Which line item are you?
I'm just asking in general.
No, I'm sorry. Madam Chair, if I might.
I'm sorry, I'm asking the question.
I appreciate that,
Hey,
but wait, if I could just for a moment. You know what, part of this process, not for everybody who's listening to the questions and answers, including the people here, is to understand exactly what's being asked and answered. If any member is going to ask if something is important, the least the member can do is identify exactly what program to which he or her is referring. That's all I'm asking.
All right. Thank you, Senator Ryder.
That's
Sorry,
fine.
sorry for interrupting,
I'll
Senator
narrow my
Hastings.
questioning. Thank
Just
you.
a real quick thing. We've been more than indulgent in this committee, giving people on both sides of the aisle the opportunity to ask questions and go through a series of a litany of reviewing and evaluating different programs over the past several years. This committee's been more than fair. We're going to give our colleagues the same opportunity on both sides of the aisle to do just that. Senator Hastings, please proceed.
So, Director Bassi, in terms of what costs more then, I mean, obviously costs, we're doing budgeting here, what would cost more, addiction treatment and prevention or incarceration or other public aid programs? Is there a cost difference? Which costs more in the long run?
There can be, yes.
So what would cost more then? I guess addiction treatment or healthcare? Or incarceration and, I mean, just in general?
I mean, it's a very global question, and there's obviously specifics, but it is possible that you could be in a case where incarceration would cost more than your addiction prevention. I understand that. That's a possibility.
Let's talk about immigration services. You did cut that program. I got a letter from Arab American Family Services, which serves the general southwest suburbs. And I don't know if you know this, but the southwest suburbs is probably one of the faster growing Arab American populations, also a fast growing Hispanic population, people coming from Mexico, other places. They need somewhere to go. They need somewhere to go to find out where their services are provided. Do you consider immigrant and refugee services an essential service?
I think that being able to provide them the care or the services that are available at our family community resource centers is a higher priority. We had to prioritize in this, faced with this fiscal crisis, and that was one area that we determined we could get by and still provide our other basic core services to those individuals. And so it was one of the line items that we had to suspend.
So I'm not going to ask you a lot of questions today like I did the other day. I think we do better in our private communications than we do in public. I do want to say, though, in terms of the two things I asked you about, addiction treatment and prevention and immigration, and those services that we provide that you cut and you eliminated those. Suspended's a nice word, but when you talk to these organizations, they're eliminated. They're not going to be able to come back and provide the same services. If they do, it's going to be at a pretty substantial cost. I just want to let you know, when you come out to the south suburbs and you take the tour and you see how the closure at Tinley Park impacted our community, this is another kick to my stomach and my community's stomach when you start cutting more of the programs, because a lot of mental health patients have addictive propensities. They do these things, and you're continually kicking the south suburbs in the gut. Thank you very much.
Okay, Senator Bennett, then Senator Rose and Murphy.
Mr. Secretary, thank you for coming today. I want to talk about two programs and their lack of notice, I guess, in preparing for the suspension. One is the Teen Reach program, which I'm sure you're familiar with. Of course, an after-school program that cares for kids between 6 and 17, at-risk youth, helping them make better decisions and hopefully save the state not only money, but lives down the road. The letter you indicated that went out on Good Friday, April 3rd, you would agree with me that's a day that a lot of people take off. Is that fair to say? Especially on Easter weekend?
Yes, I'd agree.
And so I was surprised on Monday morning to get calls from our regional superintendents saying they've received this correspondence. They didn't see it till Monday. And they had an after-school program that day where parents assumed they could drop their kids off or had not arranged for alternate care for their children for after school, and there was now no time to make alternate arrangements because the suspension was immediate. Is that correct?
Yes, it started at 5 p.m. on Friday the 3rd, yes.
That's correct. So the other program I want to talk about was just briefly the Autism Project has been discussed in Champaign, where I represent. We had this weekend a thing for United Way called Ready, Set, Grow. It allows parents to come in and get information. On Monday, prior to that, the programs went out, bulletins went out to families, let them know what resources were available, including the Autism Project. By Saturday, there was no booth for the Autism Project because the program didn't exist. We had dozens of parents coming to that event, stopping us and saying, we'd like information on the Autism Project because that program is geared for children 0 to 5 and their families. And obviously, just in my community alone, a lot of families affected by that. But just in the 4 days from the time the program went out to the event, the program is gone. In your experience, would you agree these programs, Teen Reach, Autism Project, they're not set up to carry large reserves? Is that correct?
I think that's probably the case, yes.
So when you suspend funding, that program shuts down.
It's certainly possible for some of those programs they would have to shut down, yes.
Okay. Now, we have to make tough decisions all the time. But one thing I think we should responsibly do is if we have to cut programs or funding for programs, we at least give them an opportunity to try to find some kind of alternative funding or find some other means to keep their program running. Would you agree with that?
Depending on the circumstances, I would agree with it, but with that caveat.
Okay. Well, can you articulate any conversations you had when you were first told these programs had to be suspended? Did you, in your role as acting secretary, have any conversations articulating to anyone else, including Gambi, that these programs would not have a chance to find alternative funding or find alternate arrangements, but would effectively be killed by this letter?
Well, it was, again, I go back to, and I don't want to sound like a broken record, but I have to say that this was an incredibly difficult decision, and we wanted it to get done as fast as we could to lessen the pain down the road. If we didn't get these out immediately, then you run the risk that we're going to have to make deeper or wider suspensions, as we go forward. I mean, as soon as we understood the numbers and the amount of grants that need to be suspended, we acted. I'm not saying that this is, it's obviously very difficult for these providers, and I wish it could have gone differently, but this is the fiscal reality we're in, and we had to make a quick decision, and we had to act quickly, and it's where we are, and I understand that people are frustrated and angry. If I was one of the providers, I would be hurt as well, but we're stuck in a very difficult situation.
Okay.
And hard decisions had to be made.
All right. Mr. Secretary, was there any discussion that you were part of about whether we had to cut the program, or the funding, but could we wait a month, even a week, to give people a chance to try to find alternatives to fund these programs? Was there any discussion on your part toward that?
We discussed with Gambi, and it was made clear that these needed to go out immediately in order to preserve the necessary resources to get through the rest of this year.
So are you telling me, okay.
I did not have specific conversations with Gambi. Our budget folks did, and so we cooperated through that process. I did not call Director Nuding and speak to him directly, but our budget office spoke directly with Gambi, and our budget office spoke directly with me, and we communicated in this way and determined that we had to get these letters out as quickly as possible.
But you've just stated that you knew these programs were effectively going to be killed immediately by the manner in which this was happening.
I don't know which ones, and I can't speculate on which ones. I don't have a tally of where the funding is, what other sources they have, and what reserves they had. What I did know is that we had a $1.6 billion budget hole to plug, and this is part of that process. And the longer we waited, the potential for more damage that could be done. And so we needed to get these letters out as quickly as possible.
But with the timing of it, the legislature was gone, correct? We were on break, correct? There was no one from a legislative side that could have presented an alternative side to say, can you give us a week? Can you give us a month for Teen Reach and for Autism Project to find some alternative? That's correct, right? There was no one here when this decision was made. Did you think then it was your role, did you consider that it was your role then as acting secretary to at least make that voice in the debate, to at least suggest, can we give people time? How much extra would it cost us? If cutting all these programs cost $26 million out of a $1.6 billion hole you're trying to fill, did anyone, including yourself, feel it was your role to even suggest and present that possibility that perhaps we should give them enough time to at least make alternative arrangements?
I think we were faced with very difficult decision based on a very difficult reality with this budget. And so I think it's incumbent upon myself and our agency to work closely with Gambi to make sure that responsible decisions are made. And, again, I understand that people are frustrated and angry by this. I don't fault them for that at all. But this was the decision that had to be made in order to get us through the rest of this year. And I think on your specifics as to sort of, the timing and how we had to do it, Director Nuding's going to be better able to address it, but I fully support. And I do think it's my responsibility as a responsible head of an agency and as someone that is, responsible to the taxpayers of this state to do what I can to make those difficult decisions.
Just so I'm clear, you stated that you had to work closely with Gambi, which I agree, but it's your role, they're your programs. Can we agree on that? They're under your agency.
Yes.
And are you telling me that you didn't even think that was part of the process, that you should at least even ask the question, how much would it cost us to give them a little time to find alternative funding? To give them a week, to give them 2-3 weeks, enough time to keep these programs going, or at least a chance to survive. You didn't do that.
It's my responsibility to play my role to make sure that this state can get through this year in a fiscally responsible way, and I did that.
By not even asking that question.
Our budget folks worked closely with Gambi. It was a constant conversation. The fact that I didn't ask that specific question doesn't change that our folks worked closely with the best way to approach this. And although it's not a great way, it was what we had available to us in a difficult fiscal crisis.
Thank you.
Senator Murphy?
Thank you, Madam Chairman. I sympathize with the position that you are all in. The reality of our situation is that we don't have enough money to fund all these programs, do we?
We do not.
And you have to go through the process to try to balance our budget, which the Constitution requires. You have to go through the process of deciding where to spend the amount of money we do have to most and best meet the priorities of this state. Is that correct?
That's correct.
When the budget was passed last spring, we were told that there was enough money in that budget, not appropriation, enough money in the budget to get through the year. Now, like a lot of things we've seen, is that Governor Quinn was at the helm for half of the year, and lo and behold, by the time his half of the year is done, we don't have half of the money left. You can talk about appropriation all you want, but if there's no money, there's no commitment. Can you spend appropriation, or do you need money to spend?
You need the money.
And I'm struggling to try and understand what the point of this hearing is today. I think I understand the real reason of it, but from a policy standpoint, I'm trying to understand what this is really all about, because at the end of the day, the indignation that is coming to you, who inherited a problem that you didn't create, is coming from the very people who did create the problem, who passed a budget that doesn't work. I mean, this experience right now is like watching an arsonist criticize the fireman for the manner in which he put out the arsonist's fire. I mean, this is ludicrous that you're going at this guy in this manner. Nobody likes the fact that this had to happen. But we're going to sit here and attack somebody who's trying to actually comply with the Constitution for the first time in about a dozen years and have the budget balance? I mean, come on. We have got to move on. 2015 is done. 2016 is right in front of us for the next 7 weeks. We have monumental challenges that are going to require people working together in a constructive manner. And I just don't understand how going backward on this is helping in any way, shape, or form.
Do you have another question?
No, I felt pretty good getting that off my chest just the way I did. But I might have some questions for Director Nuding. Secretary Bassi, though, thank you for your efforts thus far in withstanding these questions with the grace that you have shown, and for making the difficult choices necessary, even if they aren't a whole lot of fun and come with unfortunate consequences to people. But the consequences aren't from your choice. The consequences are from years of budgetary neglect and promising more than taxpayers have, and that's an unfortunate reality that we live under today.
So we have a number of folks who have still indicated they want to ask you some questions. Director Bassi, I have Hunter, McGuire, Biss, and Ryder. And then we are going to have Director Nuding as well come up. So Senator Hunter.
Thank you, Madam Chair. Thank you for coming, Acting Secretary Bassi. I just had several questions. One is, have you ever worked in a social service agency before?
I have not before this job, no.
Okay. Are you aware that government, especially state government, has always been the safety net for the less vulnerable, for the state that government has always been there to catch people who fall before they fall? Have you ever been
Well,
aware of
I certainly
anything
know
like
that is one of the objectives of the Department of Human Services, and that we still continue to try to carry out that goal.
Yeah. Is it more important for you to, is money more important than the children of the state of Illinois? What's more important to you?
Well, it's kind of an unfair question. Obviously,
not really.
I think that the children of the state are obviously more important, but you can't support the children of the state if you don't have the sufficient resources to do it.
But we gave you the resources. We passed House Bill 317 and 318, and if these programs were a problem during that time, you all should have said, you should have added those dollars in that budget at that particular time. And it's totally unfair for you all to cut these agencies after we've given you all the dollars. You all didn't even disclose it to us, did you?
I was not involved in any of the negotiations surrounding the budget. What
So
I
are
know
you
is,
saying that the governor's office and the budget office cut the budget and you had nothing to do with it?
well, my understanding is that Director Nuding was very clear at the legislative committees that the supplemental was part of the solution to fix the $1.6 billion budget hole, and that the suspension of grants was still a possibility and that may have to be used in order to get through this year on a balanced budget.
If you had no involvement in the decision as to which areas are cut, what do you do over at DHS? What do you do over there?
I'm sorry,
What is your responsibility? What are your functions over there,
but
sir?
you just said that I have no responsibility on which areas were cut, and that's not the case.
So you had no decisions. It was
No, our
decision was made for you.
Well, as far as what funds are available has to come from GAMBI. On how to deal with what funds we have available, that's done with our agency working with GAMBI. And so, yes, we looked at all this very closely. It was a painstaking process to go through each of our grants and figure out what we could get by with if we had to suspend or eliminate. It's the same process we went through in approaching fiscal year 16. Which particular line items could we suspend and still maintain our core services? And so that's the process that went on at my direction within our agency, and it was an incredibly painstaking and difficult process, but that's what we had to do in the face of the resources that were available to us this year in order, faced with a budget that needed to be balanced.
Secretary Bassi, is there a general feeling in your office and in the administration that social service agencies is a burden on the state and that we need to reduce the number of social service agencies in this state? Is that where you guys are going?
I don't feel that that's the case at all. I strongly disagree with that.
So are you saying that these programs are going to be back in the budget in 2016, or they're completely out of business and there's no more of them there?
Some of these
left?
programs, it is possible, will be discontinued going forward. But it doesn't mean that social services are not important. And what it means is that this agency, along with all the other agencies within the state, has to operate in a fiscally responsible way that recognizes what resources are available and how we have to operate within a balanced budget.
I've been told that there are too many social service agencies in the state of Illinois, And I'm sure that they're there because there's a great need in this great state, and that we've always taken care of our people here in the state of Illinois. But now, all of a sudden, it appears that under this administration, we can no longer take care of the people who are in greater need for the services. And I'm really, really disappointed that we're in this position that we're in today.
Well, I can tell you that we have people throughout our agency that are dedicated and will work tirelessly to provide all the services available and which the resources allow to the people of this state. And I can assure you that while I sit in this chair, that will continue.
Senator McGuire?
Thank you, Madam Chairwoman. Good morning, sir.
Good morning.
I'm Pat McGuire. I represent the 43rd Senate District, Joliet, Bolingbrook. And I'd like to ask you some questions, sir, about the Illinois Welcoming Centers, whose funding was suspended back on Friday, the April 3rd. And frankly, I'm deeply troubled by the contrast between the governor's words on immigration and your words at the top of your testimony, sir, about the mission of your department and the actions which were taken on April the 3rd. Governor, I don't know what kind of Freudian slip that was. Senator Hastings and I.
I'm a poor senator.
Last month had the opportunity to share supper with the governor, and the governor told a story obviously dear to him about one of his grandfathers who emigrated from Sweden to Wisconsin. And the governor followed that story by declaring to Senator Hastings and me, I'm pro-immigration. I'm big on immigration, Governor Rauner told us. Earlier this morning, sir, you spoke of your department's mission as moving Illinoisans toward maximum self-sufficiency and independence. You spoke of paths to independence. And the Illinois Welcoming Centers are an innovative service model that helps new Americans from Mexico, from the Philippines, from Poland, from Ireland, from all over the globe, reach self-sufficiency and independence. And you've mentioned that since January, DHS has very carefully assessed these grants. You've mentioned that it's been a painstaking process. So could you please share with us the criteria which you used as part of this process to determine that suspending funding for the Illinois Welcoming Centers comports with moving Illinoisans to maximum self-sufficiency and independence?
The entire process was about prioritizing in the face of limited resources. And we felt that it was more important to maintain the services and the availability of those services for recent immigrants at our FCRCs, our Family and Community Resource Centers, the basic benefits that the state and the basic assistance that the state can provide to all individuals. We thought that was more important. If you have to prioritize and make difficult decisions, we wanted those resources to be available, which they are. And we still have contracts for translation services, and we have staff that can speak multiple languages at these FCRCs. I'm not saying it's going to be as good of a service. I'm not saying that the welcoming centers didn't provide a valuable resource for recent immigrants. What I'm saying is that in the face of a very difficult decision, we had to choose preserving those other services that immigrants can take advantage of over the welcoming centers. It was a difficult choice, but it's one that we had to make in the face of the resources that were available.
And I appreciate your acknowledgement that the welcoming centers play a valuable role. So could you share the methodology that was used to compare the efficacy of the FCRCs in reaching immigrant populations and the efficacy of the welcoming centers in reaching immigrant populations?
Well,
do you have a methodology which you use?
Well, one, if the welcoming centers are there to refer people to services, but then the services are not available, then the welcoming centers aren't going to really be providing much benefit. So the underlying core service that we had to maintain was a higher priority. Difficult decision. You know, in the face of different resources, maybe it would be different, but this is the reality that we were faced with, and we had to make that difficult decision.
The letter which you sent to, in my case, the grantee is the Spanish Community Center, used the word suspending and suspension. Detail for us, please, the process under which it will be, a decision will be made if the suspension will be lifted, when it will be lifted, and when will that information be communicated to the grantee, please?
Well, for one, I think it would be in the face of a change of the financial landscape that we have for the rest of this year, and that's beyond, my input or capability. I think that would have to come from the legislature and the governor's office. And so, unless there's a change in that financial landscape, it may be that these suspensions carry out through the rest of this year.
With all respect, the letter is over your signature.
That's right.
Okay, so
it's suspended unless the financial landscape changes, but I can't change the financial landscape.
recalling Chairman Kotowski's comments about branches of government, thank you. So when will the information be conveyed to the grantee about the length of the suspension and what it will take to lift the suspension for this particular program? $18,000 to the Spanish Community Center in Joliet, Illinois. When will the board, which must meet May 4th, and decide whether or not to seek other resources to continue the immigrant services provided under the DHS grant, when will they learn from you what they need to do next?
Well, I believe that the letter, and I don't have it in front of me, indicates that they're suspended indefinitely unless they hear otherwise from us. And so unless there is that change, I think that the providers would be wise to operate as if that the suspension is not going to be lifted. But that's, where we're facing the situation right now.
So the glossary to your letter would be suspension equals termination.
If the financial landscape doesn't change, then yes, the suspension will not be lifted.
Will this be your final communication with the grantee?
I can't tell you that as I sit here today. It may be, it may not be.
Thank you.
All right, Senator Biss and Senator Ryder.
Thank you, Madam Chair. I'll try to be quick, and thank you for being with us this morning, afternoon. I want to ask about the process, and these questions may come off as simple-minded, but you have to understand that what's gone on has been a little bit confusing for us. So just help me walk through this, if you would. As I understand it, Governor Rauner was inaugurated, issued Executive Order 15-08 that gave the agencies directives regarding essential and non-essential spending. That kicked off a process in your shop of evaluation and assessment. In the meantime, our friends at GOMB were holding off on giving you a final determination regarding how much exactly you had to cut pending resolution of the FY15 challenges. Then House Bills 317 and 318 are signed into law, triggering the ability of GOMB to make a final determination, at which point they gave you a number, at which point you and they together decided to hit that number. We're going to do these particular things that were done on April 3rd. Is that correct?
Well, I don't want to speak, or speak out of turn for exactly what happened within Gombe, but what you've described is a relatively fair assessment of the situation.
Okay, and I'm going to do my very best to only ask you questions that shouldn't be asked of Gombe, but should be asked of you. So you were given a number at some point by Gombe then, subsequent to the passage of House Bills 317 and 318?
More or less. No. One second.
So you received the number.
Would you like him to
I want to
join?
make sure I answer this accurately.
Just introduce yourself for the record, Director.
Can we maybe have Director Nuding sit with him for these questions, just in case they happen to be more appropriate for the Director of Gombe instead of...
I'm just curious to see the world through the Acting Secretary's eyes here. But
I understand that, but perhaps we could kind of get to the bottom of it a little better if we had both of them up there to answer these questions.
Thank you. I'm going to continue to chair the meeting, though, for a moment. We're going to have him come up in a second.
I don't think I was directing, I was asking you, so I don't think I was overstepping your authority as the chair, but I apologize if you took it that way.
Thank you, Senator Murphy. Go ahead.
So again, some of this should be directed to Director Nuding. And when I say it's not a specific number, it's more of a range, you know, as they analyze where things are at, and we look at where things are at and where the funding is coming from and how much we have available. It's sort of an ongoing analysis and it's a shifting target because, and again, I don't want to speak too much because Director Nuding is going to be in a much better position to tell you exactly how the numbers shake out. But that's generally how the process worked. And,
Well,
we won't have final numbers until we need to hear back from those providers who we've suspended grants till we can give you specific numbers on how these things shake out.
Okay, so it's a shifting target, it's a range, it moves, it evolves. Nonetheless, these letters went out on April 3rd. So what number or what range did you get from OMB, from GOMB, as a result of their analysis of House Bills 317 and 318?
It's based on the projections of what we needed for those specific grants that we suspended.
There's $26 million of suspensions, is that correct?
That's correct.
So do they say fine $26 million? Do they say fine between 24 and 28? Do they say fine between 20 and 30? Do they say fine between $1.50 and $7 billion? Like, what do they do?
No, it's more of a big picture approach of we think that these particular programs that you have identified are the ones that we will need to suspend. It's a constant communication and discussion.
So it's not about, is it or is it not about the specifics of what was passed in House Bills 317 and 318?
I'm losing you here. What do you mean?
It's at some point, all of the shifting and analyzing and like, hey, this looks like something may or not be happening, turned into specific cuts. So what was the? Well, I'll go to GOMB to figure out the input, but you're saying you didn't ever get a number. These cuts just sort of happened, and if you had found 24 million or 28 million, that would have been just as good?
Well, no, it's an analysis of which particular grants need to be suspended in order to get through the rest of this year, and that's based on discussions between our budget folks and the projections that we look at, and then what GOMB looks at. And so it's to say it's a specific number, and I really shouldn't speak too much.
Okay, well, let me ask you
the
a question that I think is
GOMB
specific
did.
for you. If GOMB had determined that you needed to cut 5 million more than you cut, what would have been the next 5 million?
It's possible there would have been other grants that then would have been suspended.
But you can't tell me what they would have been.
I don't have, there are other possibilities that are not, like I said.
Right, what are they?
If we didn't get these issues, I don't have the list in front of me today, but there are other programs that could have potentially been suspended as well.
Okay, and what if they needed, what if they'd asked you to shoot for 5 million less in cuts? What would have not been suspended?
You know, I'm not going to tell you that today. I can't tell you specifically. What we know is that these are the ones that, based on our analysis, in order to get through the rest of this year, these were the specific grants that needed to be suspended.
Okay, well, I appreciate that. I guess from my point of view, an executive order was issued very, very early, I believe in the first hours of the administration, and we've been seeking to get information almost throughout that time about what's the definition of essential, what's the methodology of determination, is there a number that's being shot for, that's being sought to be achieved, and here we are on the back end, and it still remains totally opaque. And I don't understand we'll talk to GOMB about this soon, why you weren't asked to find $5 or $10 million more or less in savings. But I also don't understand why you found these 26 million instead of a different 26 million. And if some efforts could be achieved to require 6 million less in savings, what would be the $6 million of suspensions that would have been unnecessary? That methodology is very, very important to us, and at this point, you've been 100% opaque. Do you disagree with that characterization about your opacity?
Yes, I do disagree with that description of my opacity. I think that, had the supplemental not been passed, the letters that would have gone out would have been significantly more extensive and more painful than what did go out. there would have been a lot more programs and a lot more individuals that would have received those letters. And so I'm grateful that the supplemental was passed because it helped lessen this pain significantly. And so to say that there's no opacity to this is not fair, and we're listing out, and we provided you with specific programs, and I've explained to you, the process we went through to arrive at specific programs that we felt that we could suspend and get through the rest of this year while still maintaining our core services.
Okay. Well, you'll have to forgive me for having failed to, and to continue to fail to understand that explanation. But thanks again for being here.
Senator Ryder?
Thank you, Madam Chair. Mr. Secretary, welcome. I am going to start by apologizing for not some of the tough questions, because you took decisive action, and there are people who don't understand that, and those questions are most certainly warranted. But for the insinuation that because you don't have enough cash to pay for the promises that some people made, suddenly you don't care about people, that would be comical were it not made in such a serious scenario. Mr. Secretary, I also want to thank you for, saying what may be the most important thing that is said here today. And that is that we can talk about the importance of services for children, services for seniors, services for, and then fill in the blank. But if you do not have the money to pay for them, they are nothing other than a line in a press release or a comment in a committee hearing, if you do not have the money. Now, something that you said earlier caught my attention, I think in response to one of Senator Bennett's questions, and that was the issue of waiting longer to send the letters out. Senator Bennett was suggesting that maybe you should have waited a couple more weeks or some period of time to try to figure something out, and that would have been better. It's my understanding for your response, and I just for clarity here, is that the longer you waited to send out the letters with regards to those programs, which is maybe about a third of the programs of the GRF grant programs, you risked not being able to fully fund the majority of the programs under your purview. Is that an accurate characterization of what you're saying?
What I'm saying is that, yes, it creates a problem going forward as far as additional reductions or suspensions that might have to happen as a result.
Okay. So if we wait another 2 weeks or another 3 weeks or another month while people are negotiating or talking and having press conferences and whatnot, then do you at some point place at risk the other programs that are now going to get through the fiscal year in their entirety by doing that? Do you place those at risk?
Yes.
Okay. Thank you, Mr. Chairman.
I'm sorry, Senator Bennett, did you want to clarify?
If I could, I think my questions were misconstrued by the senator. I didn't ask if you could have waited to send the letter out. I asked if you could have given more notice. If the letter had to go out, it had to go out as soon as you knew the information. I was simply asking if you could have provided these agencies and these programs more time to make the plans.
Right. Thank you.
And I want to point something out as well. You just said, you told me when I asked you that you never even asked the question about how much it would cost to give them 2 weeks' notice. So I'm not sure how you can make an informed answer to the senator that it would have cost X because you never asked the question.
Well, I also trust the folks at GAMI that they know what they're doing and that they're making the difficult decisions to balance this budget that I feel should have been made for many years in the prior administrations. And so I have faith that they're doing this not out of in any callous way, but to make sure that we can get through this year on a balanced budget.
All right, does anyone else have any questions for Acting Secretary Bassi? I think we should have Director Nuding come and join us. Senator Kotowski. Well, why don't you come up, Director Nuding?
Real quick, so
while he's
I've heard
asking.
you say a couple times about resources and about having funds available. Is that clear? I've heard you say that?
Sure.
To fund these existing appropriation line items, that we don't have the resources. So I'm trying to figure out why we acted on those budget bills and why we transferred about $1.3 billion in fund transfers, and in the recent budget bill to provide those resources. When we all stood up, or those of us who voted for it on the floor, voted for it with the thought that we were going to have the resources necessary to fund these appropriation line items that were in the spending bill. So I've heard you say this a couple times about not having the resources. Well, I'm sure that the director will get at this. It's my understanding we voted to provide the resources. That's why we transferred $1.3 billion from these surplus special interest funds to make sure that we funded child care and mental health and programs related to autism. That's why we took that action. Okay, you don't need to answer that, but okay.
All right, Director Nuding, do you want to make any comments before we open it up for questions? Welcome. It's nice to see you again.
Thank you. No, I don't have any comments. I'll take your questions.
Let us dive right in. All right. Well, let me just first say, you know, I carried the bills 317 and 318. I sat next to you down there. We'll certainly recall that there'd been a question made of you during committee when we were hearing the fiscal year 15 fixed bills around what other actions might still need to be taken in terms of contracts. And my recollection is that you did say that we may still be doing other things. We still may need to, but this would provide us more flexibility. Is that an accurate recollection?
Yeah, I think that's accurate, and I believe it's been mischaracterized in many venues around the Capitol as to what I promised or didn't promise. I feel like I was very upfront. I feel like I was completely clear in what we at GOMB believed had to happen. I feel I was very clear that House Bills 317 and 318 were in addition to the activities that GOMB was already undergoing per Executive Order 8 and other activities, and that they were not instead of. I testified to that in the House Appropriations Committee. I testified to that here before you. I communicated that through all of the legislative budget staffs. I think I communicated that clearly through all of the appropriate channels. So if there was a misunderstanding, you know, there's been characterizations of lack of trust or breaking of a deal. I am completely comfortable that I was completely upfront in all of that and acted as exactly as I said I would act.
So I just want to, you know, there's, you know, in this, I know there have been times, I know I had asked, and I think our staff had asked for a listing of the different contracts that were going to be getting cut, and yet we never could get those from you or the agency directors. So we had been asking for a lot of this information, and we didn't get it until very recently.
Yeah. Yeah, so, and this goes, I think, to what Senator Biss was getting at also. So this is not a perfect process. It's not a clear-cut process. We inherited a $1.6 billion budget problem, and we have been working diligently since January 12th to try and rectify that situation. And that takes a lot of work by our office. It takes a lot of work by the good people at the agencies to try and figure out what can be reserved, what grants can be suspended. So as part of the process, and to go to Senator Kotowski's question earlier, no. The answer is no. We did not start with grant programs like autism grants. We started with Executive Order number 8, which was essentially an idea to freeze new contracts, new grants, so anything new that hadn't happened going forward, let's take a look at that. So when you look at the budget that passed, and when you get into January with a $1.6 billion hole, and you're familiar with the GRF budget, but as you start going through it and looking for areas that late in the fiscal year where you can still save money, the scope of programs is not as big as you would think. You got to look at elementary and secondary education, which we tried to stay away from. When you look at higher education, the universities had spent out almost everything by January 12th in terms of GRF. When you look at economic development, certainly we wanted to look there. When you look at public safety, well, the corrections system was underfunded. We actually needed more money, so there wasn't a lot you could do there. Human services, child care program was a big issue, a lot of underfunding in the human services area, so we didn't want to go to child care. We didn't want to go to DD or MH services, so there was not a lot there. which is why the grant suspensions are only about $20 million in that agency. Group health insurance, if you try to reserve that, you're only pushing bills off. Pensions, based on law, you can't reserve there. Statutory transfers out to local governments, we tried to cut that. The legislature wouldn't let us do it. And then debt service, you can't cut there. So what we ended up with was a situation where the universe of areas that we could actually make reductions was not as large as I had anticipated or you might anticipate. And that's why the partial solution was as much sweeps or as much fund reallocations as we could get. $1.36 billion, by the math, Senator Biss, which I know you're very good at, we need about $300 million in savings from these other activities to close a $1.6 billion gap, and that's what we're going for. And I cannot tell you today whether or not we're going to get there. We're working our hardest to get there.
Now, so you'll acknowledge, I think, from what you're saying, that nothing in 317 or 318, those House bills that we passed, is causing these grant cancellations, terminations, suspensions, whatever we want to call them.
I don't think I'd characterize it that way, but I would remind everyone that we asked in January for the ability to do this on our own. In negotiations with the legislature, which we appreciate, and we believe we got a good bill out of it, we lost 2 months of time and resources. So in the House, there were resources in terms of fund reallocations that we wanted to do that were part of Senator Kwiatkowski's bill that we could not get agreement to do. That was about $300 million in resources right there. And we came to the Senate. There was an indication that that folks didn't want to do transfers out. We wanted to reduce by 2.25% the transfers to local governments, which would have cut them by $27 million off of their $1.2 billion allocation. We could not get that done. So to the extent the bills I would characterize as getting us a long way toward the solution. Could we have done more? Yes. Did we get all the way there? No.
And this, I mean, as I say, I sat there next to you carrying these bills. I had no inclination at that time what was intended here. I just didn't. Now, maybe there'd been discussions amongst leaders and people had some understanding. I can certainly tell you, me carrying the bills did not. Never had any sense that, and the general agreement and understanding that I thought had been worked out, and certainly as had been discussed very widely, was one of general cuts of the 2.25% across the board, that we wanted to sort of have everybody sharing in that pain, with some exceptions notable for developmental disabilities, mental health, and autism. And that was the general approach. This is now going in and decimating some particular programs with seeming to me disregard for that general approach of the shared kinds of cuts. What am I missing in that? I mean, that's really, and there's choices that were made here, I think, in how to go about this. And, these were choices that were made, I think, under Executive Order 08, and certainly not a choice that was made under 317 and 318 as we put them forward.
And I think the clear truth is that the 2.25 across the board reductions did not and were not going to generate enough savings to get us there. So
then why wasn't that raised at the time and discussed to do something bigger than that?
It was raised at the time. I sat right here next to you in response to questions. I said the saving, in response to the reserves, I said the savings associated with many of those are built into this plan. So passage of this plan does not mean that all grants that are being frozen or have been reserved are going to move forward. This bill goes a long way toward closing the gap, but it does not eliminate the need to hold up some of the spending and implement some reserves in other areas. That was my testimony before this committee.
And what did you raise this in the discussions in terms of coming to agreement with 317 and 318, what alternatives might be and all of that?
Through all of the appropriate channels.
Okay,
I do not
just
get to speak
not
on
the
the
bill sponsors.
Well,
I understand. But honestly, I voted for these bills and certainly had no inclination. I had been asking, what are the contracts that are going to get hit, and never got that information back from you yourself. So it's a real sense of frustration that I have in this.
I agree with that. I think the sense of frustration is on both sides. I've spent 25 years in this building. I believe building credibility, being a trustworthy person, And to have folks say that we broke trust or we weren't completely clear, it's frustrating to me as well.
Yeah, no, I know, and I know Senator Katowski and Senator Menard, and I'm sure others are going to have questions here.
So real quickly, and Director, appreciate you being here. Do you think that in the supplemental bills were passed, if they had included a zeroing out of funding for autism, that they would have passed?
I don't know. I don't know. I mean, there was nothing zeroed out in that bill.
We're having a frank discussion here.
Yes.
About our conversations about the budget. So I think you were well aware of the concern of the members of our caucus. And I appreciate by the way, you're taking responsibility for this, but I don't necessarily believe that the buck stops with you.
It does.
No, I don't think it does. I think we have a chief executive who runs the state. And so my concern that I raised is that, I mean, there was a reason why we had wanted to include that funding in there. So and you said, I don't know, I would probably give you an answer, right? I don't think it would have passed because members of our caucus and a lot of people in this building wanted to see funding in place for autism, for epilepsy, for special needs, as well as child care and mental health. That was an important part. That was a very public part of the discussion. And so I'll answer it for you. I don't think it would have passed, but we would have prolonged a lot of these challenges. And we wouldn't have been able to have the celebratory language that was issued by the governor. He said, as promised, we're eliminating a $1.6 billion deficit without borrowing or increasing taxes on hardworking Illinois families. He said that as a result of the fact that we passed this legislation, this bipartisan agreement. Do you agree with that language? Do you agree with his statement?
Yes, it is my intent to get a balanced budget out of the bills and the process that we have in place. And the passage of the bills, I believe it was a remarkable achievement, and it gives me hope, and that's why I have such frustration with the situation that we have now, because I do believe we can work together. I do believe that we can establish trust. I do believe that I am a trustworthy person, and that what I say I will do, I will do.
So, again, I appreciate the fact that you're saying, I've had, my experience with you has been more than positive. And I've had good conversations with you about this. I'm just trying, you can see how I would hope that we and the general public look when we read a statement like that we're eliminating a $1.6 billion deficit because of the actions that we took. And then subsequent to that, further actions had to be taken, which basically contravened or contradicted the actions that we had previously had taken. We gave the legislative authority to provide transfer dollars to fund these programs, right? I mean, I kind of, walked through it before, and Senator Staines had talked about the 2.25% cuts. That we gave, and then there's statements that are made here about that the revenue wasn't available in the budget bill that was passed to pay for the appropriation. Which, if that's the contention, I'm very surprised because I never heard that. And I never heard the administration say that. I never heard the governor say that. So can you imagine how this would be surprising?
Again, Senator, I would refer you to my testimony in front of this committee that indicated that further action would or could be necessary.
But you said, and I get back to your thing, you said that were frozen or have been reserved, right? Those are the words that you used.
This bill goes a long way toward closing that gap, but it does not eliminate the need to hold up some of the spending and implement some reserves in other areas. So, I mean, that's really, to get back to my esteemed colleague, Senator Biss's statement about opaque, it's a very opaque statement. That's a general statement. I shouldn't say opaque. It's a very general statement, as much as I love that word that was used.
it's a very general statement, and it doesn't really provide specifics. And I think we trusted in the fact, and I trusted in the fact, that given the agreement that was negotiated, that moving forward, that some of these areas of the budget that we wanted to be protected would be protected. I understand that you reserved this authority based on the executive order that was interpreted as looking at what's essential and not essential spending. But I think, as you said, you've been around here for 25 years, established a strong reputation, and well-deserved, that if we knew that 2 weeks after this deal was passed, that $26 million of grants of these line items that were put into the budget were going to be suspended, I would not have voted for the bill. Can you see why?
That's a fair point.
Okay, thank you. And then so I'm going to let Senator Rauner proceed.
Thank you, Madam Chair. Tim, are we done suspending grants for the fiscal year?
That's a good question, Senator. We are still reviewing. I think most of the reviews have been done at the major agencies, but I would caution the committee that there is the potential that given the 2.25% appropriation reductions, that we may have to deobligate some spending in other areas to live within those appropriation limits. So again, agencies are reviewing. I don't know what those are yet, but there is the possibility that based on appropriation limits, we may have to look at other areas that to this point we have held harmless.
Between now and the end of the current fiscal year, regardless of FY16?
Well, this is yes, and I would say that because we really, whereas in some other instances you could argue we have a choice, I would say we don't have a choice because we don't have the resources. In these other particular areas, we don't have a choice because we cannot spend beyond the appropriation authority that we're given. We can spend less. It's a maximum. Appropriation authority is a maximum, not a minimum. We can't spend above that. So in areas where we may have obligated beyond the appropriation that we were given in House Bill 317, we may have to take some action in those areas.
So it's a possibility that there could be additional grants suspended between now and the end of the fiscal year to make up for limitations that you are experiencing given the nature of where we are in the fiscal year.
I think that's possible, yes.
Okay.
And I don't know what those are yet, but that's possible.
Do you have an idea of where you would start?
Well, I mean, it wouldn't be where we would start. It'll be dictated to us by the bill. So if we have areas where we've obligated up to the old appropriate and the new appropriate that's 2.25% cut is too high, or is too, that our obligations would exceed that, then we're going to have to pare back to live within that appropriate.
Okay.
And it'll be all of those instances, I believe.
So when would affected parties know whether or not they would be in that category of spending?
I don't have a specific date for you, that sooner rather than later. I mean, we are working as hard as we can to get these things done because, again, we don't want to exceed those appropriation limits.
Okay. Your memo that was sent to agency directors and CFOs March 31st memo, can I read you a couple sentences?
Sure.
I want you to explain a couple things for the committee. Second sentence in the first paragraph, the enactment of House Bills 317 and 318 will provide us with additional tools and resources to accomplish this important task, which is closing the $1.6 billion deficit. Next paragraph, the corrective actions we have taken jointly to date to reserve spending and suspend non-essential contracts and grants are still as important today as they ever were. Is that contradictory? Are those two sentences contradictory? Enactment of the bills will provide us with additional tools and resources.
Yeah. No. I would see that first sentence as being additional tools and resources in addition to what we were, the processes that we were already undertaking on our own accord. So as you know, Senator, there are some things that an executive branch can do on their own to try and reduce spending, and there are some things that we need the legislature's help to do. which is why if we could have done it all on our own, we would have. And that was the initial request, was for you to just give us the authority to do it. The legislature didn't want to do that, which we negotiated on that. But I saw 317 and 318 as in addition to what was already underway in terms of the processes.
Next sentence, some have erroneously assumed that Executive Order 15-8, who are some?
Yeah. This is just when I was concerned because, candidly, I started hearing the chirping. And
From who?
From blog posts, press releases, from folks that there was a trust broken or a deal had been broken, and I wanted to make sure that the agency directors knew that we were continuing with the process because we needed to continue with the process to get to our number.
The process of suspension and elimination?
Of reserves and grant suspensions, yes.
Okay.
Things that we could do on our own.
So the some have erroneously assumed, that's not agency directors?
Well, it could be, but I didn't have any knowledge that agency directors believe that. But this was as I started hearing that, I wanted to make sure that agency directors understood that we needed to continue that process.
Okay.
Just making sure.
Non-GRF grants that have been suspended.
Yes.
Tobacco quit line, for
Yes.
example.
Yes.
What's the goal of putting those grants in the suspension? So at this point in time, now that the two bills have been passed, signed into law, they're public acts, what's the point of keeping those in the category of suspension?
Well, first of all, we want to do a comprehensive look at the budget. So we are trying not to draw large distinctions between other funds and the GRF, where other funds could be used as resources to fill GRF holes, and certainly to...
So is the goal to keep those things in suspension so that there may be an opportunity to take more funds from, say, that particular...
There may be, if we save that money, there may be more surplus built up in the tobacco fund. You did authorize some reallocations from the tobacco fund as part of House Bill 318. In addition, many other things are funded out of the tobacco fund. As you know, the Medicaid program receives a lot of expenditures from the tobacco fund, and we felt that preserving those resources for the Medicaid program and being able to meet those bills and provide those services, I believe the decision was made that that was a larger priority than the quit line.
So the quit line itself, so let's drill down into that. Don't we know that saves Medicaid money? Don't we know that? It's got a 50% success rate. It fields tens of thousands of calls a year. I think we have data that shows that many people that access that are Medicaid recipients. Don't we know that saves the Medicaid program money in both the short term and the long term?
Well, I'm not a program expert, so I would defer you to the agency, and it may.
But are you looking at those types? So when a grant's suspended and it's a non-GRF grant, and we have two bills that have been passed and signed into law to close the gap, which is what you asked for in front of the committee and what the governor asked for, we know that this one saves money. So I think there's others like this in the budget, which I think is a fair assumption. Is that what you're going through right now, to determine which ones are valuable expenditures and which ones are not?
We're going through with agencies which ones are core, which ones which ones can be suspended this late in the year, which ones, if we suspended them, would free up resources that could be used toward the $1.6 billion hole. Yes.
So to this one specifically, its continued suspension frees up resources how?
Resources that would be in the tobacco settlement proceeds fund that some of which have been swept in House Bill 318, some of which could be swept in the future, some of which will continue to be spent on Medicaid
on other
services.
Things that are authorized to be spent from the fund.
Correct.
Okay.
Yes.
Can we talk for a few minutes about there was a series of tax expenditures granted by DCEO, and I know that Director Schultz isn't going to be in front of us today. Can we talk about the timing of those and the nature of those and their connection to the current fiscal year budget?
We can. I mean, I would defer to Director Schultz on the policy question with regard to whether those move forward. My understanding with them, those were not part of the normal process that we're undergoing with regard to some of the other grants. My understanding with those is that they are revenue neutral and do not affect the FY15 budget. But in terms of the policy or the process of that, I would have to defer to the director on that.
Who makes the determination that they're revenue neutral?
I think that would be the Department of Commerce and Economic Opportunity.
Does Gombe play a role in determining the status of a tax expenditure, whether it's going to cost money in a fiscal year or not?
In this case, we have not. I would certainly like to be involved in that evaluation process and other evaluation processes with revenues in terms of tax expenditures that may be out there that folks are talking about. We would defer to the Department of Revenue on a lot of that. Gombe traditionally had a revenue unit. We have really relied more on the Department of Revenue to handle that stuff, so we would defer to them, but certainly we would like to be involved in those discussions.
So Acting Director Bassi made the case multiple times, probably 36, that his role as the director of DHS, which I would frankly disagree with, is to fit expenditures into a larger state budget construct that had a hole in it in January. How does the $100 million tax expenditure not go through that same process in your office?
Well, again, I think the determination was made that there was no FY15 impact, so it does not factor into the numbers that I am dealing with.
How does a EDGE tax credit, arguably, we should note, was probably hashed out before Governor Rauner took office, but at the same time, we have to acknowledge that somebody's signature from the Rauner administration is on that grant. How does that not get put under the same scrutiny as every other grant that was eliminated or suspended from an operational perspective? Why do we put tax expenditures under less scrutiny than spending and appropriation pressures that are authorized by the General Assembly?
Well, I don't know that I would say it was under less scrutiny. I would say certainly it did not play into the closing of the $1.6 billion hole, which is what I am laser focused on right now, and so it was not a part of that process. That doesn't mean it wasn't. I'm sure DCEO does a very thorough job of evaluating those things.
But there was no, in terms of its effect on the fiscal year, there was nothing from Gombe that determined whether or not it played into what your balance sheet is for the current fiscal year? I mean, there was nothing that said that this is going to cost us money in FY15?
No, in fact, we were informed that this would not cost money in FY15. So
By who?
I believe by DCEO.
Okay.
I mean, I can't speak to that directly because I did not talk to Director Schultz specifically about that, but with staffs working together, that was the impression that I have received.
Okay. Moving ahead to FY16, given the back and forth that we've had about the $26 million. By the way, if how much was swept in 3.7 or 3.18? Was it 1.3 billion?
1.366.
Okay, so if we would have just added 26 million to that, would these cuts have been avoided at DHS?
Certainly would have made it less likely, but we would still be shooting for the $1.618 billion.
Was that part of the conversation when that bill was negotiated?
I don't understand the question.
Was if we don't get to 1.38 something, we're going to have to move 26 out at DHS?
I talked many times with staff about wanting to get to a point where we actually had a cushion, because I felt a cushion was important, for two reasons. One, don't forget we have a giant backlog of bills, but number two, I don't know what's going to happen from this point forward. With regard to the fund reallocations, we might get sued somewhere and get something held up. So I did not want to be in a position where we pass a bill with no margin for error, get something that I can't foresee happen, and then we fall short of our goal. So I was very clear about the need, about my personal desire for a cushion. And in fact, I lost that cushion along the way with the things I talked about earlier, the $300 million in additional fund reallocations from 3 funds that were in Senator Katowski's bill, but that did not meet with agreement in other parts of the legislature. My desire to reduce by 2.25% transfers to local governments, to the RTA, to things like the Abraham Lincoln Presidential Library and Museum. Those were taken off the table as further parts of the negotiations, costing us $50 million in potential savings there. So again, I feel like I was clear with the people that I was dealing with that we were trying to build some cushion in, especially with regard to the fund reallocations.
For FY16, we authorize, right? We set a limitation, more or less limitation on appropriation. So it's up to the executive branch to spend the money. How do we know as appropriators that that when we vote on a budget, hopefully within the next few weeks, that the money that was appropriated for a program, whether it's autism, whether it's general state aid to schools, whether it's for mental health programs, whether it's for the summer lunch program in Wilsonville, how do we know that when we authorize that in the coming budget, that it's going to get spent either under its normal course of business starting July 1, or that this time next year at the end of fiscal year 16 that a particular grant isn't going to be suspended? What assurances do we have that just because we appropriate, that money's going to get spent? Because I think Senator Katowski has a valid point. Mm-hmm. If autism was off limits from the cuts, I think that sends a message to the administration about heightening its importance. If programs were added to in the budget, if there was additive in the supplemental, I think that shows that there was heightened importance from the appropriators and our co-equal branches of government and the back and forth that we have to go to. So I think by the mere fact that the General Assembly appropriates, that signals that it's important. So how do we know that no matter what it is, the thousands of programs in the state budget, that the administration is going to spend money on what we appropriate?
Well, I think the best way to ensure that, and that's the way we want to operate, is to pass a balanced budget, that we get together and for FY16 we pass a balanced budget so that we don't have to come back in the middle of a year and have crisis situations where we have to start looking for savings to make a budget balance. Let's pass a balanced budget with a little bit of cushion to pay down the backlog of bills, and I think that's the best way to ensure that happens.
Thank you.
All right, I have Senator Biss, Murphy, and Bennett. And please add Senator Altoff to the roll. Sorry, Senator Altoff.
Thank you, Madam Chair. Thanks for being here. So the whole issue is that there was a $1.6 billion hole. House Bills 317 and 318 included steps to ameliorate that problem. You've said both now and as you indicated before that they were important and significant, but they missed the mark. They didn't achieve the full $1.6 billion of needed budget relief. Is that correct?
I have said that we needed the actions we were taking in addition to those bills to hit the mark.
So how much did HB 317 and 318 miss the mark by? Again,
you're going to use the opaque word again. It's not as simple of a question as you think it is, Senator. Let me give you an example. 2.25% reduction to a line item that potentially is going to lapse money anyway doesn't save any money, okay? It doesn't save any real money. It just reduces appropriation authority. I believe that 317 and 318 don't get us all the way to the $300 million we needed. I believe that through the reserves and the grant suspensions, we need to get well north of $100 million in savings from those activities in order to hit the mark. But that is not an exact science at this point. It just isn't.
So on the topic of Senator Katowski's favorite word, opaque. Look, whatever. You're right. Obviously, you know, reducing an appropriation in the instance when the money wasn't going to be spent anyhow doesn't result in real budget relief. And I'm sure you're right about lots of other more complex examples that make this not an exact science. So in between the passage of HB 317 and 318, which are long but fairly cut and dried specific numerical actions, and the enactment of the sending at least of letters on April the 3rd, which is again a specific numerical set of actions, there's a whole bunch of other complicated stuff. How can we, the legislature, and you, GOMB, work together in the course of your navigation of that fuzzy stuff to avoid these moments where we're blindsided?
Let's avoid crisis governing. Let's pass a balanced budget.
So that's to say that it would have been impossible. There's nothing that could have been done to make this less surprising in the FY15.
Well, I'm not going to say that, but we are working at light speed to try and get this thing under control because we inherited this budget deficit and we're trying to solve it and we're trying to work with you to do it. Could we be more,
transparent?
You always can be more transparent. We're trying to accomplish a task. We think we started meeting with your staff almost right away. We've been as transparent as we can be. We continue to try and provide the information that you ask for, but we have to have it in order to provide it. And some of that still rests with the agencies in doing the work that they're doing. So it's an inexact science. It's a much less than ideal process. I don't ever want to go through it again. I hope we don't. And there's a simple way to not do that, and that's to pass a balanced budget, and we hope to work with you to do that.
And I share that enthusiastic hope. I guess I would just say that what I don't share is your level of optimism that this exact scenario is the only one that can result in difficult, quick decisions that you'll need to make. I don't think your job gets easy on July 1, quite frankly. I think your job's going to stay real hard as long as you keep it. And it's going to result in some hard to foresee situations and other just hard to manage situations. And transparency with us will be very, very, very important in building and then retaining that relationship of trust that is itself a prerequisite to working together to pass those balanced budgets. Thank you.
Understood.
Senator Murphy, then Senator Bennett.
Thank you, Madam Chair. Director, nice to see you. Just one point I just want to reiterate and kind of come back to because I think it gets lost in this bigger conversation a little bit. Am I correct in stating that what happened on April 3rd with those reductions was necessary because we don't have the money to fund the budget that was passed at this point?
Yes, based on our determination, yes.
Now, and before I go into my final point, I will go to the 2015 fix, House Bills 317 and 318. I think you've gone at length into how we arrived at the bills that we arrived at and that there were other alternatives that maybe would have forestalled or prevented some of the cuts that were particularly objectionable on April 3rd. There is certainly a scenario whereby if a different bill were passed or if it were passed earlier, that there would be the potential that we would have avoided some of the more difficult cuts that came on April 3rd. Would you agree with that?
Yes, that is certainly a possibility.
Now, I also share, though, your broader optimism about, and I did, and I still do, for the fact that 2015 deal was struck in a bipartisan basis